Bon dia. My name is Jean Michel Molina from Paris, and it's a pleasure for me to participate today to the Latina Forum in Florianópolis. It's a great pleasure to be here and to talk about the work we've done in France on doxycycline prophylaxis for the prevention of sexually transmitted bacterial infection. As you know, DoxyPEP is a new intervention that seems to be promising for preventing bacterial STIs in people at high risk, in particular syphilis and chlamydia, and to a lesser degree, gonorrhea. I mean, what we've done over the last 10 years is multiple studies in France that were also conducted in the US. And all the studies conducted among MSM and transgender individuals have shown that giving people at high risk of STIs, and those at high risk can be identified by people who are young, who have experienced STIs in the past, who have multiple sexual partners. And for those individuals, if you give them DoxyPEP, and the way you give them this DoxyPEP is 2 pills of 100 milligrams, so overall 200 milligrams of doxycycline within 24 hours after sexual intercourse, when people do not use condoms. You can give DoxyPEP up to 72 hours after sexual intercourse. And doing that, usually people take DoxyPEP once a week. Then you reduce the incidence of syphilis by nearly 90%, nearly 80% reduction for chlamydia infection as well. And for gonorrhea, the reduction is lower in the range of 30% on average. These are data from MSM. We don't have data at this point in women, but it's likely when you look at the PK of doxycycline that the same results could be obtained in women, but we're still lacking clinical data in women because the only trial who has used doxycycline in women in Africa failed to show a benefit of doxycycline, most likely because women in that trial didn't use doxycycline. When you measure drug levels in hair or in plasma of these women, you couldn't detect doxycycline in the vast majority of them. One of the issues with this strategy, which is, by the way, very cheap because doxycycline is available as a generic, so it costs really nothing. One of the issues is obviously antimicrobial resistance, not for chlamydia or syphilis, because for those organisms, there is no resistance that has been described so far in humans, because these bacteria have a difficult time to incorporate new genes. And so for those bacteria, it's very difficult to become resistant to doxycycline. For gonorrhea, on the other hand, this is a bacteria that has become resistant to all antibiotics that have been used to treat this infection. And doxycycline actually is not used to treat gonorrhea because across the world, the level of resistance of gonorrhea to doxycycline is very high. In France, it's nearly 92%. So when we use DoxyPEP, it was not to have an impact on gonorrhea. But what we have seen when using doxycycline to prevent STI is that we've seen an increase in high-level resistance to doxycycline, which is not, again, a big issue because we are not using doxycycline to treat gonorrhea, but you may have cross-resistance to other drugs. In our study, we haven't found any cross-resistance except for cefixime, a third-generation oral cephalosporin, which is sometimes used to treat gonorrhea. One of the issues is what about ceftriaxone, which is the standard of care for gonorrhea. So far, we haven't seen any impact on ceftriaxone, but we still need to monitor, antimicrobial resistance for gonorrhea. At the same time, large studies have shown that when you use doxycycline for prophylaxis, as expected, you would increase the rate of doxycycline resistance in other bacteria, for example, Staph aureus or Strep A. And studies have shown a small increase, but significant increase in the rate of doxy resistance in those bacteria, even though you reduce the rate of carriage of those bacteria. So overall, it's a balance between the risks and benefits for antibiotic prophylaxis with DoxyPEP. The benefits we know is reducing very strongly syphilis and chlamydia, And the risk is a little bit of increase of antimicrobial resistance, not for chlamydia and syphilis at this point, but more for gonorrhea or other bystander bacteria. So eventually you have to make a decision for your patients. And if you choose to give them DoxyPEP, you should use wisely. As I said, not more than once a week. And if your patient experiences a bacterial infection, you probably need to avoid doxycycline to treat this bacterial infection because there is a high risk that this infection might be resistant to doxycycline. So with that, I thank you for your interest in the work we've done to prevent STIs in high-risk individuals. Thank you.